Hi guys, it's always a privilege to speak to you. My name is M. Moody. I'm a medical imaging and diagnostic radiographer with special interest in ultrasound. This morning I would like us to talk about the role of ultrasound in prostate cancer screening. I know prostate it has become a major issue. Prostate cancer has become a major issue in men in the current years. And I believe there is so much information outside there about prostate cancer, about prostate screening. And let us just look at the role of ultrasound, on why we do ultrasound to men, especially those who are 40 years, just to screen towards early detection of prostate cancer. One of the reasons why we do this is just to look at the size. Just to look at the size. We want just to look at the size of the prostate. There's a special size. There's a specific volume of the prostate that is supposed to be there when it's a normal one. So when you're doing ultrasound, one of the things we want to look at the size. Is it enlarged, or is it a normal size? The next thing we want to look at the normal morphology or the normal outline of the prostate. Do you have any mass? Do you have any growth that is growing in the prostate? We also want to look at the calcification in the tissue of the prostate. Is there any calcification? Then we also want to look at the urine outflow from the bladder. Is the prostate obstructing the urine outflow from the bladder? Then we also want to look at just the pelvic organ. These are structures called seminal vesicles. Are they inflamed or are they normal? Then we also want to look at the blood flow in the prostate. Is it increased or is it normal? When you look at all these things and then you compile them, they'll always point us towards either indication, or they'll always give us indicators if we're dealing with the prostate cancer, or we're just dealing with an enlarged prostate due to age. So I think the best thing is at this particular time, at this particular age, even as you approach 45 years, my advice to men is, let us go have a screening done, just to make sure that your prostate gland is okay, and you're not running into the risk of having prostate cancer. And as I've always said, if we detect, even if you had prostate cancer, if we detect it early, it's easier to treat. The cost of treating cancer which is detected early is low as compared to the cost of treating cancer which is detected late in stage. So the best thing is, let us have this thing done. Prostate ultrasound is a very painless procedure. There's no pain involved when doing a prostate ultrasound. So there's nothing so much to fear. It's a simple procedure. So if you go to that, if you are in that age bracket, you can always get time, go have this thing done, have this screening done, have a prostate ultrasound scanning done, so that at least we can detect some of these issues. And one thing I will always want to encourage even our government, that as we talk about healthcare, as we talk about early diagnosis of cancer, my advice is, let us all try to invest in these equipments, even in the government hospitals down there in the villages, so that at least every Kenyan can have access to this infrastructure. Every Kenyan can have access to these facilities. And one thing I would always want to say, as a also health economist and policy expert, let the government try as much as possible invest in the universal health coverage. I know this is something that has been started in this country, but even as the new government comes into power, my prayer is that the government will see it good, the government will see it fit to invest much and to make sure that they implement universal health coverage, so that our people can have access to healthcare, so that our people can have access to quality healthcare. Because at the end of the day, we want to serve our people, we want to serve this nation, and we want to have a society where healthcare quality is high or is on top notch. So my advice is, let us all try to come up with policies. Let us all try to put our monies, our resources in healthcare, so that at least our people can have access to call it healthcare in terms of cancer screening, so that if we can screen cancer and detect it as early as possible, our treatment and the treatment procedure for these diseases can the prognosis can be better, and our people can always have a quality life. Thank you very much.